Joining me now is the director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci. Good morning, Dr. Fauci. I want to start by saying this. We report the numbers of deaths and cases every day, but I want to pause for a moment and ask you your reaction to 350,000 deaths we've now reached. Did you ever expect it to be that high?
No, Martha, I did not. But, that's what happens when you're in a situation where you have surges related to so many factors, inconsistent adhering to the public health measures, the winter months coming in right now with the cold, allowing people or essentially forcing people to do most of their things indoors as opposed to outdoors, and then the traveling associated with the holiday season is all of the ingredients that unfortunately make for a situation that is really terrible. I mean, to have 300,000 cases in a given day and between 2,000 and 3,000 deaths per day is just terrible. I mean, it is. I mean, there's no running away from the numbers, Martha. It's something that we absolutely got to grasp and get our arms around and turn that inflection down by very intensive adherence to the public health measures uniformly throughout the country with no exceptions.
Dr. Fauci, the president just tweeted that the number of deaths is far exaggerated, blaming the CDC's what he called ridiculous method of determination compared to other countries. Your response to that?
Well, the deaths are real deaths. I mean, all you need to do is to go out into the trenches, go to the hospitals, see what the healthcare workers are dealing with. They are under very stressed situations. In many areas of the country, the hospital beds are stretched. People are running out of beds, running out of trained personnel who are exhausted right now. That's real. That's not fake. That's real.
And Dr. Fauci, we saw that the U.S. is vaccinating only about 200,000 people a day, with many states using just a small percentage of the vaccines they have received. What's the biggest cause of this delay?
Well, I think it's just trying to get a massive vaccine program started and getting off on the right foot. There have been a couple of glitches. That's understandable. I think the important thing, Martha, is to see what's happening in the next week to week and a half, because the original projection that General Perna, who's in charge of the actual ultimate shipping and distribution, there's allocation, there's shipping, there's distribution, and then there's putting it into people's arms. So they were promising that they would have about 20 million doses that were allocated, shipped, and distributed. They fell short of that by the end of December, but in the first couple of days in January, they're catching up with that. What we need to catch up with now is getting into people's arms, because there's now about 4 million. We wanted to get to 20 million. But some little glimmer of hope is that in the last 72 hours, they've gotten 1.5 million doses into people's arms, which is an average of about 500,000 a day, which is much better than the beginning when it was much, much less than that. So we are not where we want to be, no doubt about that. But I think we can get there if we really accelerate, get some momentum going, and see what happens as we get into the first couple of weeks of January.
And Dr. Fauci, the president puts responsibility on the states, but Utah Senator Mitt Romney, as you might have just heard, wrote this week that it was unrealistic to think that healthcare workers already overburdened, or CVS and Walgreens, could really handle that vaccination program, writing that comprehensive vaccination plans have not been developed at the federal level and sent to the states as models is as incomprehensible as it is inexcusable. Is that inexcusable?
Well, what we need to do, Martha, is we've got to get interaction between the federal government and the states. To say the federal government should do it themselves, that'll never happen. To just leave the states on their own without any help, without any instruction, without any resources is going to be tough. You've got to have a combination of both. You have to have a real interaction, a real partnership between the federal government and the states. That's what we're trying to do. Hopefully that will then materialize as we get into the beginning of this year. But you're absolutely right. If you try and do it one way or the other, it's not going to work. It's got to be pulling together, both federal and state.
We'll have a new president in a few weeks. What difference do you think the public will see when Joe Biden's president?
Well, I mean, we've already heard the president-elect Biden talking about the kinds of things that he wants to see done, and that's going to be hopefully uniform throughout the country. What the president-elect said about masks, everybody wear a mask, no exception. Everybody for the first 100 days, probably well beyond that, but at least for the first 100 days. The goal of vaccinating 100 million people in the first 100 days is a realistic goal. We can do 1 million people per day. You know, we've done massive vaccination programs, Martha, in our history. There's no reason why we can't do it right now. The classical one that people should just go back and look at, go Google it. It's really interesting. In 1947, when there was a case of smallpox of an American who was vacationing in Mexico, came back to New York City and infected a group of people. There were a total of about 12 hospitalizations and 2 deaths. New York City, in March and April of 1947, vaccinated 6,350,000 people, 5 million of which they did in 2 weeks. I was a 6-year-old boy who was one of those who got vaccinated. So if New York City can do 5 million in 2 weeks, the United States can do 1 million a day. We can do it.
We'll hope that happens, Dr. Fauci. We've heard about this new strain, this new variant. How concerned are you about that? And would the vaccine protect against that?
Well, let me tell you what we know about that, Martha, and we'll get more information because we'll be studying it ourselves because, as you know, that mutant is already here in the United States, has been well reported. The Brits have a lot of experience with it. They tell us that it is a mutant that seems to spread more easily. Namely, it is more contagious going from one person to another. But what they tell us is that it is not more virulent. In other words, it doesn't make people more ill or cause more death, and it doesn't appear to evade or elude the protection that you would get from the antibodies that are induced by the vaccines that we're currently using. That's what they're telling us. They know what they're doing. I believe them, but we're going to look at it ourselves. We have a lot of people right now carefully looking at each of those.
And Dr. Fauci, we have just a couple of minutes here. You have predicted that things could be back to normal by next fall. Does that count on herd immunity from 75 to 80% of the population before things are back to normal? And you heard those reports about some healthcare workers aren't even taking the vaccine.
Yeah, it is totally going to depend on the uptake of vaccines. If we get 70 to 85% of the population vaccinated, and we start, right now we're getting the people who are in the priority groups. By the time we get to the end of March, the beginning of April, I would have hoped that we would have taken care of all of those priority and have what I call open season on vaccines. Namely, anybody who wants a vaccine can get a vaccine. If from April, May, June, July, and August, we do the kind of vaccine implementation that I'm talking about, at least 1 million people a day and maybe more, by the time we end the summer and get to the fall, we will have achieved that level of herd immunity that I think will get us back to some form of normality and maybe quite normal.
Okay, we'll all hope for that in the new year. Thanks for joining us this morning, Dr. Fauci.
Good to be with you, Martha. Thank you for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.